Our group did a personal health record. This is Cheyenne Kosinski,
Krista Beardsley,
Katherine Breuer,
Amber Martin,
and Monica Boykins.
What is a personal health record? A personal health record is basically an electronic application that patients can use on their own to manage their health information. It's private, secure, and confidential. What is included in a personal health record? Anything medically related can be put in by the patient, such as health insurance information, medication history, routine and emergency contact details, family and social history, allergies, and hospital visits.
This is Katherine Breuer, and I'm going to talk about the benefits and drawbacks of a personal health record. So, to improve patient engagement, the patients can update and track their health over time and have information about the management of their health. With that, it will encourage them about their health and their health care. To ensure patient information is available, if the patient personal health record is online and the correct people know how to securely access the record, it will always be provided online, which helps if information is needed in emergency cases. To enhance care provider-patient communication, the PHR will allow direct, secure communication between the patient and the provider. It can also make communication faster and easier. Because the patient has logged all the information in the PHR, so they should already know what everything means, which allows for the doctor and patient to talk about more important things rather than spending valuable time trying to understand everything. It also encourages healthcare management for the patient. With the ability to update the record at any time, it can improve the healthcare quality the patient has received. So then, the patient is informed and up to date with their healthcare, which helps them be a better advocate for themselves. For the drawbacks, it can be very time-consuming. Building and maintaining the record takes up a large portion of the time, although it will keep a patient organized. It asks for very specific information, for example, when a prescription was filled. The security is also a drawback because if the wrong person becomes informed of a personal health record either through word of mouth or login credentials, that person could validate and violate the patient's HIPAA protection. The last drawback is data accuracy and literacy. When a patient does find time to update the personal health record, they may not know the correct way to enter in the exact care that was provided to them, so the medical lingo may be typed or written wrong, which could present data inaccuracy and potentially harm them in a way later on in the future for preventing other care that should be administered or receiving care that is not needed.
This is Krista Beardsley, and I'm talking about if the information on the personal health record is private. People are most concerned about personal health record information being kept private. Reliable electronic personal health record systems follow some of the best practices and ideals. The privacy policies are made public and are monitored by independent organizations. Federal laws have also been put in place to protect the security of the personal health record. So all of these laws are available to the public, and they help keep everything safe with regards to HIPAA and other personal information. How is the personal health record related to nursing? The personal health record is a collection of information about your health. It has all general information, like stated before. Having a personal health record allows you to have access to your medical information at all times. So at office visits, you're able to give it to the nurses, and it helps make their job easier. Patients with a personal health record will be able to give those nurses vital information at a much quicker pace than going through old papers or different files to try to figure out the information that is needed. Some statistics are from a 2008 Markle Foundation poll. 42.7% of 1,580 Americans surveyed kept some type of personal health record. Less than 3% of those people kept personal health records electronically. 80% recognized the benefit of an online personal health record. And about 57% expressed concerns with privacy and security of their public health or personal health record.
So this is Monica Boykins, and I'm going to talk about a few PHRs. A self-created PHR can be written out or made on the computer by the patient themselves. Some users print their self-created PHR so that they can have it on hand for when they meet with their physicians. Online services provide a template for users to create a PHR, and some even request the users to make a PIN so that they can access the PHR on any device. Some examples are the AHIMA, or the American Health Information Management Association, Microsoft Health Vault, and MyPHR. With a self-created online PHR, physicians are able to access the PHR. When creating a PHR online, it's very important to read the website's privacy policy since a lot of your own private information will be stored online. Smart cards. Smart card PHRs are similar in appearance to credit cards and store personal health information on them. A physician is able to insert the smart card into a special reader and access a patient's health information quickly with a password or PIN. Smart cards are now being used in many healthcare facilities across the U.S., including several hospitals in New York City and over 19 hospitals in Pittsburgh. Like any other PHR, there's a security risk that comes with using a smart card. These cards have been equipped with special encryption and tamper resistance.
This is Amber Martin, and I'm talking about the Practitioner-Instituted Personal Health Record. Practitioners have instituted client access to their health records in the form of e-encounters. An e-encounter is a two-way exchange of information between healthcare providers and the patients. Electronic access falls into 4 categories: a vendor-created and clinic-hosted, such as MyChart and eClinicalWorks, a self-built and provider-host, such as MyActiveHealth and Health Profiler. Another one is self-built research system that is an agency neutral, such as the one that was developed at Boston Children's Hospital. And the last is a system that links electronic medical records and personal health records where information can be imported from other sources such as pharmacies. And overall, a personal health record is an electronic application that's used by the patient to maintain and manage their health information. They're private, secure, and confidential and allow patients to communicate with their providers. PHRs help patients keep track of all their health information, such as their diagnoses, their medications, allergies, and immunization history. It makes your healthcare information accessible to you at any time by using any web-enabled device, such as a phone, computer, or tablet.
And these are our citations that we used to compile this presentation.